Hi, everyone. My name is Kassie, and I'm the Pediatric Physical Therapist with Inspire Connections Therapy. And I'm here to talk to you guys a little bit more about what pediatric physical therapy is and how it can help your child. So, physical therapy for children works on strength, flexibility, balance, coordination, ball and playground skills, as well as spatial and body awareness. And this can be seen through activities such as sitting at the dinner table to eat, sitting in the classroom, getting dressed, bending down to touch your toes or put your shoes on, walking across different surfaces at home or on the playground, completing activities like jumping jacks, hopscotch, and playing ball skills, so kicking, throwing, and then playing on the playground, as well as knowing where their body is in space, being aware of people around them, and not tripping over and bumping into different things. So, some parent concerns that might warrant PT. We see commonly is parents have concerns that their child is not meeting their milestones. So they're not rolling, sitting, crawling. Their child's constantly falling or bumping into things. They're not keeping up with their peers on the playground. Their child's getting easily frustrated with different activities, or their child generally gets fatigued with activity. So, some signs that you might see in your children that could indicate they need PT. W sitting is a big one. This can indicate low extremity weakness and core weakness, which can lead to other difficulties with activities. Toe walking is also a big one. We want that to be addressed as that can cause further issues, especially as the child gets older. If your child has awkward walking or running patterns, this could indicate coordination or balance issues. And if they're showing signs of pain, such as avoidance of a specific activity, if they're tearful or uncomfortable with something, or they're verbally saying ow or grunting, this could mean that there's pain involved with the activity and that needs to be addressed. So, some things that are normal versus abnormal. So, it is normal for kids to toe walk when they're younger than 2. This is just their way of gaining their balance and strength. And it's also normal for their toes to point slightly inward until 3. Anything after those years is something that we want to take a look at and see if there's something else going on. It's not normal for your child to favor one side. So if they're only rolling to one side or always pushing up on one side, that's not something we typically see, and we would want to get that evaluated, as well as repetitive movements and uncontrolled movements, especially if the child's unaware that they're doing them. That's something that we want to get it looked at and make sure there's not something else going on. And why is physical therapy important for your child? So it's going to prevent future issues. So if your child is having issues with their fundamental skills, addressing them earlier on will prevent any other issues down the line, such as further delay in development, injury, things like that. It's also going to improve your child's confidence and overall well being. So, just making them feel better, feel healthier. It's going to increase their independence at home and in the community, such as at school and playgrounds. It's going to help them with their activities of daily living. So, they're going to have the balance to be able to get dressed. They're going to have the balance to get in and out of the bathtub or the shower. They're going to be able to help with stuff around the house. It's going to make a lot of things easier on you, as well as give them the independence and learn how to take care of themselves. And it's also going to help them to develop play skills, and they're going to be able to make those connections with their peers because they can do the same things that their peers are doing, and they can run and play with the ball and keep up with them. So thank you for listening. If you guys have any questions, feel free to contact us. We are open, and we have no waiting list. So if you would like to get in, just give us a call. And thank you again.